My top three for the department would be to expand the educational programs coming out of our health department to make sure that we preach the gospel of wellness and self-control of our bodies, number one, and our health. Number two, I want to work more closely with other agencies, particularly Harris County, in having a seamless health care delivery system. And number three, I want to try to expand the network of neighborhood clinics that are available, and the city play its appropriate role there. So education, coordination with other governmental agencies, and expand the network of clinics.
We need to promote, and I emphasize promote, health and wellness out of the department. They need a mission statement that starts with that. We need education and prevention as well. You know, earlier I talked to a few out here about, you know, a catastrophe. We have to be ready. We need to be educated, we need to be trained, we need to run simulations. And you don't just do it once a year. It's continual. You fill those gaps that you have. We see that in the education right now. You do it once or 2 years. No, you do it every year or maybe possibly twice a year. So you're continually improving. And three, we have the world's largest medical center here. And we also have a great county public health environmental services department. We need to bring them together with the city health department, the city that is the fourth largest city in this country. Bring it together with the county, which is the third largest county in this country. We have the expertise, the world's greatest medical center, and those would be my top three priorities.
We leave millions of dollars on the table in Washington. We don't have an effective grant writing, grant coordinating program within the city of Houston, and I would ensure that that would happen. So first and foremost, make sure that every bit of money that we can possibly move to Houston comes to Houston. And then it's a matter of what we do with those dollars. I would critically examine every program in the city health department in light of what other service providers are out there, who provides the best care based on a series of metrics, and then figure out where the money needs to go. One of my frustrations as a council member was seeing the city as the pass-through agency for federal grants, but then we were also competing for those grants with community-based organizations. Makes no sense. We need to figure out who does the best job on some objective standard and push the money to those organizations. And then finally, there are a lot of health issues out there, childhood obesity being one, but HIV and AIDS continues to be a grave concern to me. I've spoken to kids. I have, along with some of my council colleagues, publicly taken an HIV test to encourage women to take the test. But this is something that kills our kids, and we have to put ourselves out there, and we have to put the health department out there to do a better job.
Well, my three priorities are this. First, we need to expand the network of neighborhood health clinics. That needs to involve a lot of organizations, including Harris County Hospital District as a key player and funder of this. The second thing is, I'll mention something new, and that's improving air quality. The largest cause of admissions to Texas Children's Hospital is acute asthma. And we need to send a message around the world that we're a clean air city. There's a huge community health problem here. And the third issue is that we need a plan, folks. We need a plan. You can't go to Washington and ask for money unless you can show your plan. That's why we haven't gotten the federal dollars for transit. We need a real plan, a development plan for the city of Houston. And we need a health care plan that really has some specifics and nuts and bolts in it that'll coordinate all of these fragmented efforts that go on. That's what we're suffering from. Everybody who's a healthcare professional, Ms. Schwartz, you know this. It's all fragmented, everybody competing for the similar funds at the foundations and stuff. We've got to bring the foundations in, the providers, the city government, the mayor, and we got to have a coordinated Houston health plan to get much better results in the future, and we will solve the problem that way. But without a plan, I think we're just doing what we did last year, kind of fishing in the dark.